So this is post-operative cruciate care, incision care, and bandage management. And we'll start with how the incision looks. And as you can see, there have been surgical staples placed here. And management of a wound like this, long after the bandage has been removed and until the staples are taken out, is to watch for any signs of swelling or discharge. And typically discharge will occur at the bottom end or at the top. However, if there's any parting of the incision, you can see there's a slight little divot here. That's not parting. If there's a parting of the skin in this direction and it's more than 1/4 of an inch, you should contact us or the emergency clinic, because if it's opening more than 1/4 of an inch, chances are it'll open further before it gets better. Another thing to consider is that normally there'll be a bandage placed over top of the leg. If the bandage is in place, it usually extends up to about the thigh up here, and then extends all the way down to the hock. However, usually we bandage a little bit further down to the foot. And the things you want to watch for, once the bandage is placed, if there's swelling of the foot, you won't be able to put your finger or your thumb between the toes very easily. So you need to check that that's always okay. The bandage is left in place for 3 days. And if during that period you see the toes begin to swell, that's really the only thing we worry about. You can take the bandage off at home or come down to the practice and have a complimentary recheck exam with the technicians to ensure that the bandage is removed carefully and everything is okay. However, if it's a Sunday afternoon and the bandage has peeled down, say somewhere about here, you can temporarily bandage it up with medical tape, or if you're not comfortable, just take the bandage off. However, if the bandage is off once the incision line is exposed, you need to ensure that the dog cannot lick or chew at the incision. And if that becomes a problem, then you do need to get intervention from the emergency clinic or ourselves to obtain either an Elizabethan collar, which is a funnel collar or the cone of shame, or a Baskerville muzzle, which is sort of a plastic cage muzzle over the mouth but allows the dog to drink. Some people prefer the funnel collar and some prefer the Baskerville muzzle. I generally prefer the Baskerville muzzle. One more thing to think about is after we've got the incision managed and the bandage is off, once the bandage is off, we need to do some physiotherapy. So we'll do that next.